My name is Madison Gray. I'm a student nurse at the University of South Alabama, and I'm going to be performing the NG insertion checkoff. So she's going to scan the room. Upon entering the room, I will perform hand hygiene, and I will verify the order and the hospital policy, and I will identify my patient using two identifiers. I will be using his name, Jaguar Jones, his date of birth, 8/25/1963, 8/25/1963. I'm going to assess his allergies. He has an allergy to penicillin. And then I would explain the procedure to the patient while also providing privacy. I'm going to gather all my equipment, which I have here, and including my pen light and tongue blade, which I'm going to put in my pocket, and the stethoscope. I'm going to don my goggles, and then I'm going to perform hand hygiene, and then I would raise the bed to a comfortable working height and lower the side rails. I will auscultate the bowel sounds, and then also assess the vital signs and the oxygen saturation using the pulse oximeter. If there is a decrease in their oxygen saturation or a deterioration in the vital signs, I will stop the procedure and continue until the patient's stability is determined. I'll raise the bed to the high Fowler's position, and I'd also establish a cueing sign of my patient if the procedure needed to stop, such as holding up the number 1. I'm going to open my contents, and I prepare the lubricant, and then I'll prepare the tape. So for the tape, I'm going to have 4 pieces. I will have 1 for the label, 1 for the cheek, and then I will do 1 for the measurement on the tube. Now I'll put it in a dog ear so it will be easier to remove. And then I will do the fixation tape. And then I'm going to loosen the syringe, make sure it's working properly, and put on my gloves. I will then check for the patency of the nostrils by having them to close one side and breathe, and then do the other side. And then I will prep the nose with a alcohol skin prep, or you could do it with soap and water. And then I'm going to measure my tube. I would normally do this without clothes on, but for the sake of the video, she's gonna have her clothes on. I'll measure it from the nose to the ear, and then from the ear to the xiphoid process, which will be about 50. And then I'll place the tape where I marked it, so 50, and I'll put the dog ear tape right there, so I know where to do it. Then I'm going to place my towel in my basin on the patient's abdomen, and then I'm going to coil my tubing, just make sure it's loose, and then I'm going to lubricate 4 inches. And then I'm going to begin the insertion. So I will make sure this isn't tangled up before I do it. I would have my patient extend their head back onto their pillow, and I'm going to put it in downward till I reach the nasopharynx. And when I reach that, I will have them tilt their head forward and relax, and I'm going to have them take sips of water or dry swallow as I advance it in about 1 to 2 inches, rotating at 180 degrees. And if my patient, I want to make sure that I don't force or push against their resistance as well. And if my patient coughs or experiences any other types of respiratory distress, I will pull back into the posterior nasopharynx until I can continue and continue to have them swallowing. So I'm going to stop when I get to my placement mark, and when I get there, I will secure it to the cheek with my tape. And then now I'm going to use my pen light and my tongue blade to check, to make sure in the back of the throat that it is positioned in the right place. So I would shine the light in there and look to make sure. And then I'm going to also, to check the correct placement, I'm going to be using my syringe to check for the, if they're to pull any aspiration of the gastric contents. I could also assess their pH if indicated, or get an x-ray performed. That back in there. So now I'm going to remove this from the patient's nose and discard, and then prep it, discard, and then secure it with the vinyl fixation tape on the patient's nose and the tubing. So there's not any pressure on the nose, on the tubing. And then I'll remove the piece from the tape, or from the cheek. And also I will make sure to put discard of that, and then put the label as well on the patient's nose. And then I will clip it to the patient's gown, and when I clip it to the gown, I want to make sure that they can turn their head and that there's enough slack for that according to the hospital policy. And then I will use the marker to do the indelible marker to mark the exit port for any placement. Now I'm going to do the suctioning. So for the suctioning, I'll remove this, and I will use this straw today for the suctioning, and I would place it at the low intermittent suctioning like this. And then if I wasn't using suctioning, I would cap it like this and place it above the patient's head. So now that I've done that, I'm going to put my patient back no lower than 30 degrees. I'm going to raise the side rails and lower the bed to the lowest position. I want to make sure the call light is in reach, and that I'm going to assess the patient's comfort. I'm going to clean up everything, discard of it, take my gloves off, and perform hand hygiene. And then I will document the type and size of the NG tube, the type, the location, whether it was in the right or left nair, how it was secured, how I verified the placement, if there was any suctioning, the patient's tolerance, and then the amount, color, and characteristics of the secretion. So now I'm going to remove the tubing. So the first thing I want to do is verify the order. I want to perform hand hygiene. I'm going to be using a towel right here to remove it. And then I will also want to explain the procedure to my patient and put on my clean gloves. Okay, so I would use my stethoscope to auscultate the bowel sounds, I would turn off the suctioning, and then I'm going to remove the tape. From the tubing. As well as the clip. And then I want to encourage my patient to hold their breath, inhale and then hold their breath while I remove it. So I'm going to be removing it and by kinking it up onto itself. And then I'm going to dispose of it. Now I dispose of that. And after I do that, I'm going to measure the drainage, I'm going to perform oral care, and then I would document. Thank you.